A recent study showed that taking aspirin at night can lower blood pressure. Once again, the doctor is in. And Larry, could you please explain the findings of that study?
Yeah, aspirin is truly a wonder drug, and this is another one of the wonderful things that it does. In this study, people taking aspirin who had moderate or pre-high blood pressure in the 120s, or systolic, they took aspirin at night, and it seemed to lower their blood pressure about 5 points in the morning. That's an important finding, but the real important finding about aspirin is that it cuts down the chances of dying from a heart attack or a stroke by about 30%. The way it does that is prevents clots from forming. Platelets are the blood cells that circulate in our bloodstream, and they stick together when there's a cut or any irregularity in our blood vessels, and it starts this clotting mechanism. Aspirin interferes with that.
Now, what is the difference between, say, taking aspirin and Aleve? Why would I choose aspirin?
Okay. Well, aspirin has these unique properties. It takes care of fevers and pain and headaches, but it also prevents the clotting from forming. Tylenol is acetaminophen. It takes care of fever and pain, but has no effect on clotting, so it will not protect you from having a heart attack or a stroke. Aleve, Motrin, Advil, those are called non-steroidal anti-inflammatory drugs. They take care of fever, they take care of pain and headaches, but they don't prevent clotting very effectively, so they're not good to prevent heart attacks and strokes. Additionally, sometimes ibuprofen, which is Motrin, can interfere with the aspirin. So if you're taking aspirin as a medicine at the advice of your doctor, take aspirin about 2 hours before you take ibuprofen.
Ibuprofen. I noticed you were saying 81 milligrams as the magic number for aspirin. Why not take a full dose? Wouldn't that be more coverage?
Yeah.
Wouldn't that be more helpful?
That's an excellent question, but more is not always better. And studies show that the adult aspirin, which is 325, is not as good in preventing heart attacks and strokes than the 81 milligram aspirin. So if you're taking it for that specific reason, not for a headache, not for pain, but to prevent a heart attack or a stroke, 81 milligrams seems to be the ideal dose, and it'll cut down the risk about 30%.
Now, I also noticed that we have Lowdose and Chewable, and both are 81 milligrams. Why would we have a Chewable?
Well, Chewable, some people can't swallow, but Chewable gets the aspirin in you instantly almost.
Okay.
So if you think you're having a heart attack,
that's the one to take.
Yeah, you want to do a chewable aspirin. If you think you're having a stroke, which is decreased blood flow to the brain, that could be due to a clot or a bleed. So you don't want to take aspirin if you think you're having a stroke, because if it's due to a bleeding problem, you can make it worse.
And finally, who should take aspirin?
The general recommendations are anybody who has one risk factor. So a woman in her 40s to 50s, or a man who has diabetes or high blood pressure or high cholesterol, and they have no other reason not to take it, meaning they don't have ulcers, they don't have bleeding problems, they don't drink alcohol excessively. So the recommendations are anybody with a cardiac risk factor would benefit from aspirin, 81 milligrams.
Well, thank you so much, Larry, for all these wonderful tips on great heart health. And thank you so much for joining us.
We look forward to seeing you the next time. I'm Dr. Larry Santora.
I'm Heidi Cortese.
And remember, your health matters.
Be well.